All right. Good afternoon, everyone. I just started the recording and we're going to go ahead and get started. Thank you all for joining us. Um, we are really glad to have you here today. Um, we are hoping that this will be an informative and engaging session. I am Gabrielle Gassaway, the Community Health Program Manager with Accessia Health, and I will be hosting the meeting today, helping everyone get through their slides and moderating the chat throughout the session. Before we get started, I just want to cover a few housekeeping items. All lines are muted throughout the duration of this webinar. However, we welcome you to submit any questions throughout the event through the Q&A section on your screen. You can find that down at the bottom in the toolbar. We will have a time at the end of the presentation to answer questions. So please share those questions as they come up for you throughout the session. For the convenience of some viewers and those who are hearing impaired, closed captioning has been turned on. Additionally, the webinar is being recorded and will be available at accessiahealth.org following today's presentations. We don't have any polls, so you won't have to answer any questions. A quick disclaimer, Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any of our speakers today or any other third parties are not necessarily those of Accessia Health. And without further ado, I would like to hand it over to my colleague Jennifer, who will be serving as the moderator for the remainder of today's webinar. She'll be introducing each of our speakers and leading our moderated discussion after the presentations. Jennifer Noonan is the Vice President of Clinical Strategy and Patient Engagement at Accessia Health. She is a dedicated healthcare professional with over 25 years of clinical nursing experience, which is showcased through her program design and service delivery with our organization. And so I will hand it over to her to introduce our first speaker.
Thank you very much. Just quickly tell you a little bit about our organization. Accessia Health is a non-profit nationally dedicated to addressing the needs of people with rare diseases and chronic conditions. We have a unique approach to traditional patient assistance. It's holistic, inclusive, and outcome focused. Our disease-based programs cover a variety of healthcare expenses, including copays, premiums, and travel. To learn more about our organization, please visit our website at accessiahealth.org. And without further ado, I'm excited to introduce you to our first presenter today. Her name is Alejandra Lopez. She's a dedicated clinical social worker at the Orthopaedic Lifespan Hemophilia Treatment Center in Los Angeles, where she brings both professional expertise and deeply personal connection to her work. She earned her undergraduate degree in medical sociology from Mount St. Mary's University and her Master of Social Work from the University of Southern California. Coming from a family affected by hemophilia B and being a carrier herself, Alejandra has witnessed firsthand the challenges, resilience, and strength of this bleeding disorders community. This personal experience fuels her passion for advocacy, patient support, and holistic care, making her role more than just a career. It's a lifelong commitment rooted in empathy, understanding, and lived experience. She strives to empower patients and families by fostering connection, education, and access to resources, ensuring that each individual feels seen, supported, and understood. Handing it over to you, Alejandra. I'm excited. One moment, Alejandra. I think we still have to get you unmuted. It doesn't show you're muted, but I'm unable to hear you.
I'm also not able to hear you.
No.
Check to see if it's on the correct microphone.
Yeah. If you click the audio, I think that's where I find it.
or no?
Oh,
Can you hear me?
Yes,
yes.
there we
Yes,
go.
there you are. Great. I'm
So
sorry.
I'm going to use my phone now as my microphone. I am so sorry. This did
Oh,
not
no
happen
worries. We can hear you
yesterday.
great now. Okay.
Okay, so back into it. My name is Alejandra Lopez. I am the social worker here at the Orthopaedic Hemophilia Treatment Center. And today we're going to be focusing on how individuals and families affected by a bleeding disorder can better navigate daily care, access to psychosocial support, and feel more confident moving through the healthcare system, which already is very complex. Just a quick little introduction. This right here is my team. We're a small but really great team here at LA Ortho. So, bleeding disorders, as you may all know, is a lifelong condition that not only requires medical management, but also strong emotional, social, as well as community support. As my role as a social worker, we play an essential role in the HTC in helping patients connect these pieces, ensuring that they have the resources, the guidance, and the advocacy needed to build a coordinated care plan that truly embodies the whole person. So, let's move on. Okay, next. Okay. Oh, no, went too fast. Okay, perfect. Okay, so these are the best practices for managing bleeding disorders outside of an emergency setting, coming from my lens as a social worker. So, as we all know, effective daily management goes beyond medication. It's about establishing supportive routines and reducing barriers. More and more, we're hearing now that psychosocial support is also healthcare. That is the best part about this. So, what do these practices include? It is empowerment through education. One of my important roles here as a social worker is to help patients and families feel confident in managing their bleeding disorders, as well as working with our multidisciplinary team to help with that as well with our patients. But we make sure that they understand their diagnosis, what symptoms to look out for, and what steps to take during the bleed, right? Education is what reduces fear and helps, reduces fears and helps families feel prepared rather than overwhelmed, right? We don't want them to continue feeling stress over these situations. We want them to understand, okay, if they have the tools that they need to understand their diagnosis, then they are able to succeed. Simple tools like fact sheets or symptom checklists can make a really big difference in helping them respond quickly and safely. And that is something that we do offer here in our clinic. Routine treatment adherence. That is a big component here. Encouraging consistent use of prophylaxis or factor replacement when prescribed and helping troubleshoot access issues, transportation, and insurance barriers. You would be surprised how often I have to have these conversations with our patients to ensure that, they're up with their prophy schedule. I try to ask, okay, what's going on? Why are you no longer keeping up with the schedule? There is such a psychosocial component to that I tap into, especially with our younger guys, when they're in that teen phase, trying to understand why is it that you don't want to do your prophy? Why aren't you wanting to take care of that that part of yourself, really trying to bring back in that mental health component into their medication management. A safe environment planning. So, supporting families in creating bleed safe home environments such as fall prevention, proper storage of medication, and emergency planning. So, really going over those questions when we're here for an annual, making sure that they still have all these components established in the home and understanding, okay, how do you feel about managing your medication at home? Do you need any sort of home health coming in? Do you need any physical therapy just to look at, for example, in the shower for any sort of bars to be included in there, stuff like that. And then care coordination. So here at Social Workers, we help patients navigate all the moving parts of healthcare from appointments, referrals, school accommodations, communication between providers. We help them in speaking up during these medical visits, right? And helping them stay organized. By streamlining this communication between the care team, we are helping families feel supported and ensure that their care is truly coordinated between all moving parts of our HTC team. So a large part of our role as social workers helping the patients build that confidence in managing these challenges before they become emergencies. In our next slide, we are talking access to resources and community support, which this is like the bread and butter of my role in the HTC, right? Navigation, even for me, is very overwhelming. So imagine having families who are already dealing with medical needs, work, school, finances. Sometimes it's overwhelming to understand where are my resources at. So social workers help bridge these gaps by connecting patients to both national and local resources. So I myself am a big supporter of our local Hemophilia Foundation, which you'll get to meet Rigo a little bit later, in the SoCal region. So these are just other resources that I do utilize within our clinic, as they all have great resources to tap into, with NBDF, with the HFA, with our local chapter, with insurance navigators through Medicaid, through the on here it's called Cover California, but through the marketplace as well as through Medicare. I play a really big component in understanding, okay, what resources are really needed for our patients. So that is all coming into our annual visits where I do a social detriment screening and I ask those really uncomfortable questions for our patients. But with those uncomfortable questions comes true connection where I'm able to really understand, okay, what support do they need? How can I tie them into local chapter events? How can I provide financial assistance? How can I get them transportation? All those moving parts are such a big component to their care. And as social workers, we're the ones who really help bridge those gaps for them. I also forgot to mention on here another great one, which I do utilize all the time, is Hope for Charities, which is a great one for patient support. They're a great organization. So I totally forgot to mention that one, but that one's a great one for our patients to utilize if they ever need financial assistance. Now, the psychosocial support and including the multidisciplinary care team. So, bleeding disorders are impact is not only physical health, but also the emotional well-being. So I build the ability to identify, have school participation, and family dynamics are also really a part of their care team. So social workers assess the whole picture. I'm looking at everything, right? If you are having lack of access to transportation to our clinic, then your care is going to be what's it called, affected by that. So I help bridge those gaps. So I'm looking at this whole picture. So I'm looking at how the family is adjusting to this chronic illness. So helping families and the youth to understand their diagnosis and cope is a big part of my work when I'm going in for an annual. Like how I always like to ask these guys, from the moment, a lot of my population is on the older side, but I do have a few younger ones. But is asking, how was it from growing up till now? How are you viewing this? And it's very interesting to see how different it is from our older generation to our younger generation. I've always had the picture from, as mentioned earlier, I'm coming from a family who does have hemophilia. And I always like to ask my dad, hey, how was this growing up? And it was very hard. But seeing how they're adjusting to what it looks like to be older with hemophilia is very different. And it's something that I'm continuing to learn more about. The anxiety and fear of bleeding. Such a big one with our older guys versus the younger ones. I think the younger ones have this idea that, the medication is very, very advanced from what it was. So it's very interesting seeing how different it was from them to the older ones as well. So there's such a big component on that, as well as mental health needs, identifying depression, grief, burnout, or social withdrawal, and referring to therapy when needed. So within each visit, I do utilize a PHQ-2 scale, and that is helping me be able to identify where my patient is in regards to their mental health. I always like to offer referrals to mental health providers if it's working with their insurance or is it with myself. But majority of the time, I do get a no. But I always like to sneak it in with something like, you know what, let's do a support call. Let's just like do a check-in. Nothing more than that. Just wanting to see where they're at if I'm seeing there is an impact on that PHQ-2 scale. Family stress. So living with this, I've seen it firsthand how it is for our caregivers who do experience exhaustion and financial strain and difficulty balancing all these responsibilities. As we had these conversations so many times before, I see it a lot with our moms. They take on that burden for themselves of like, I have to do everything because they feel that guilt. But understanding, we here at the HDC are able to support them, and also me just coming from a household with hemophilia, I'm able to connect with them in that level of saying, I know what it is, what care looks like once you leave these doors here at the HTC. I understand that, I understand that fear that they might have. I understand, okay, making sure our family members are on that prophy schedule. I get that. Now, my favorite one, which is something that it's a current thing going on, is that transition to adulthood. This is something that we're trying to work on with our patients, especially with our adolescents, so our teens here, which is very few, but we're working on it. It's helping adolescents build that independence, learn their medical history, and navigate school and work environments when dealing with their bleeding disorder. So as mentioned before, moms take on all of this, right? Because they have this idea that, I gave this to them, I have to, take care of it. But you know what? The kids, we wanted them, all our patients to understand they can be in charge of their own care. And we want them to have that confidence to be able to call the pharmacy on their own, to call for medical appointments, and to let us know if they're having a bleed. We're more and more, we're becoming a little bit more stricter on, if we have mom calling, we're like, you know what, let's have them call, they're over the age where they're considered a legal adult. So we're trying to build up that confidence within our youth when we're talking about transition to do all these things on handling their own medical management. So why does this multidisciplinary team work? Like, why does it matter? So with hemophilia and HTC, you're going to have your physical therapist, your social worker, your nurse, your a hematologist. Sometimes you'll have a dentist. Sometimes you'll have a psychologist. Whatever it is, when we are going in for our annuals, we are wanting to talk about the different areas of care with our patients to understand that we're getting a whole picture of what it looks like for them when they're managing their bleeding disorder, when they're at home, when they're at work, when they're at school, whatever it looks like. And when we're able to work together as a team and have that understanding, we're able to build a care plan that is very easy for them to follow and accessible for them, right? We want to make sure that we are making this straight and narrow, no surprises here for our patients. And then when we're talking about communication with patients, caregivers, and providers, this is the strongest component when we're talking about bleed prevention or any other sort of complication. From my lens, a social work lens, we are focusing on teaching advocacy. So I want my patients to feel confident in sharing their concerns and their symptoms. I want them to feel comfortable also with our providers and ensuring that they're able to really dive into those areas and help us have a better understanding of what's going on. Um, we want to have this environment where we're building a patient-centered communication. So we want to make sure here in the center that we are ensuring that our providers are listening, they're having their active listening skills, and they're presenting any information in accessible ways. So what that means is really having that clear communication and understanding and using that language where the patient is able to understand that, having all this medical jargon really be thrown at us, even for me, sometimes I'm just like, that's too much. How can you simplify this for me so I can have an understanding and I can even explain this to my mom, my grandma, or someone. That's how I always look at it. They have to be able to explain this to someone else. And then second one is supporting caregiver roles, helping families coordinate schedules, understand treatment changes, and collaborate with schools and workplaces. So a large part of my role is doing this as well. When we're talking about transportation, when we're talking about 504 plans, when we're talking about work accommodations, I'm working with our care team as well, saying, okay, this is what they presented to me. What can we put on this as examples for our patient's workplace or school place to put into the 504 or to the work accommodation so that they're able to succeed and continue working. And then the big topic, as everyone is doing, if you're a part of an HTC, this is their QI project, is transition readiness. So encouraging adolescents to speak for themselves during visits, refill their own prescriptions independently, and understand insurance basics. A large part of my role every single time when we're coming in for an annual is asking them, and you'll be surprised how many don't know, what type of hemophilia you have, what type of medication are you using? And it's like reminding them, this is what you're using. This is the type of hemophilia you're at. This is the type of severity you're at. We're wanting our adolescents to become, the pioneers of their own care. So that is a big component in how I run my structure here at the HTC. I do utilize care plans, fact sheets, reference tools, something that just like is like a quick little thing for them to grab or to look at, and they're able to understand, okay, if I need to go to the emergency room, I write it down. This is where you should go. If I need a refill of my prescription, I write it down. This is where you can call or text. We do have texting options now available for our patients because we understand the youth loves to text. And then, you know, and I get all these tools. I want everyone to know I get all these tools that's either utilized from our local chapters, from NBDF, from HFA, all these organizations that are able to have, they have a bunch of tools, and I take a little bit of everyone and I make my own for our center. So that is a big role in how I think our patients are able to take control of their health and manage it and feel confident. So just for our closing remarks when we're looking at this, able to go. Oh. Managing a bleeding disorder involves far more than just treating the bleeds. It involves daily routines, emotional support, strong communication, and access to community resources so that our patients feel like they are involved in a community that cares, right? As social workers, our mission is to ensure that individuals and families never navigate this journey alone and have the knowledge and support that they need to drive when managing their bleeding disorders. And I think that is it.
Thank you. That was great. Always love hearing from social workers. Going to introduce our next speaker, who is Brendan Hayes. She is the Senior Director of Education at the National Bleeding Disorders Foundation. And prior to her work with NBDF, she was the Executive Director of an NBDF affiliated chapter. Her expertise lies in developing accurate, accessible, non-biased educational content on innovative therapies and treatments. And the goal is to ensure that the consumers understand their treatment options, enabling them to participate in shared decision-making. Brendan is passionate about including lived experience experts in the identification and creation of the educational content. Her expertise also includes collaboration among innovative therapies stakeholders, alternative financing strategies for innovative therapies, and policy and advocacy within rare disease. She serves on national committees, task force, and working groups that are focused on the innovative therapies for rare disorders and speaks at both national and local conferences and events. She has a Master of Public Health with a concentration in public health leadership and a certified public health professional. All right, it's up to you, Brandon.
Thank you so much for that warm introduction. I appreciate that. So I am going to focus today on consumer educational resources from the National Bleeding Disorders Foundation. I will say that we do have excellent provider resources as well. If you go to our website, which is bleeding.org, we actually have a provider tab. And again, we have lots of resources. So I wanted to quickly talk about our mission. Our mission is that we're dedicated to finding cures for inheritable blood and bleeding disorders and to addressing and preventing the complications of these disorders through research, education, and advocacy, and enabling people and families to thrive. So, I'm going to be focused on the education piece today, which is, again, one of our pillars. But research and advocacy are also very important in our organization. So I'm going to focus on here some of our key educational programs. So first up is our Steps for Living website. This is a comprehensive, easy to navigate learning platform. And it's for all ages and stages. We have content for kids up through adults. We are really focused on helping people navigate living with a bleeding disorder. And we have content for people with bleeding disorders, caregivers, newly diagnosed families, and some of the subject matter that we're focused on are things like basics of a bleeding disorder, treatment options, staying healthy, and everyday life living with a bleeding disorder. And I'm proud to say that all of the pages on this site are in both English and Spanish. Okay, so the Thrive campaign. So this is a campaign that, where our goal was or is to educate individuals with bleeding disorders and their support networks about 6 key steps for leading a healthy life. So we had a program many years ago called Do the Five, and this is sort of an extension of that, and it's been updated. So, there are pieces of the program that we're trying to get people to focus more on. And again, you can pick one and focus on that. You don't have to do all six of them, but take advantage of regular care from healthcare providers. Have a conversation with your healthcare provider and, about your yearly inhibitor testing. Reviewing the latest treatment options. So again, that's part of what we're trying to do is make sure that people have the most up-to-date information. Identify, treat, and fully heal bleeds. Don't wait around. Jump in and get that bleeding episode treated. Value and make time for your emotional and mental health. And then finally, embrace your bleeding disorders community and get involved. So that's a little bit about the Thrive program. And on each of these slides, I've included both links and a QR code for people to learn more. Okay, next up is our Connections for Learning program. This is such an inspiring, awesome program. So we have a bleeding disorders conference yearly in August, and this is an opportunity for people to apply for a grant to get them to the conference. And the applications are going to open in January, so monitor our website for that. And these grants are for individuals and their support network affected by a bleeding disorder. And applying does not guarantee acceptance. There is a rigorous process. There are essays involved, but it's extremely rewarding. It enables people to build community, make friends outside their local area as well. I also wanted to talk about our clotting cascade video series. One of the things that we've experienced in bleeding disorders is this amazing innovation. However, with that comes opportunities to learn more, right? These new innovative therapies don't work like factor replacement therapy. So it's been really important to us to ensure that people understand how these different therapies work in the body. So anything from bispecific antibody therapy, to these new rebalancing agents. So these are quick 3-minute videos that help people understand not only how the clotting cascade works, which is the foundation, the first video, but how the different treatment options work in their bodies. Also wanted to highlight the NYLI program. This is the National Youth Leaders Institute. And this is a program that is focused on creating leadership opportunities for individuals in the bleeding disorders community that are about 19 to 23. And it's a 2-year program, so it's a 2-year commitment. And our next cohort, we just brought a new cohort on here in 2025. So the next one will be in July of 2027. So recruitment is going to open up at the end of next year for that program. Also wanted to talk a little bit about shared decision making. So the NBDF, along with WFH and EHC, worked collaboratively to create this shared decision making model. And I could talk about this for hours, and I don't know we don't have that much time, but really what I wanted to focus on here is the importance of thinking about things like what are your life goals and, your current treatment options, learning about all the different treatment options that are available. This tool actually walks you through all the different treatment options and, preparing for a visit with your healthcare provider, thinking about what you want to talk about and ask in advance, because as we know, we don't have a lot of time when we sit down with our healthcare provider. So this tool will actually help you figure out what you're most interested in, what would be right for you at this stage of your life. And you can actually print out documents and either email them to your provider in advance or bring them with you to help you have those great collaborative conversations. Now, quickly, a little bit about our publications and resources. So we have resources and publications for the community. We have rare factor deficiency booklets. MASAC for you. We have content for people with VWD. We talked about the Thrive campaign. We have mental health resources, lots of information on gene and innovative therapies and more. And most all of these are in both English and Spanish. So I wanted to showcase again, where you can find the publications online. So in addition to the publications, we also have lots of video and webinar content on our website. Also wanted to talk about MASAC for you. So MASAC is the Medical and Scientific Advisory Council, and they're focused on coming up with recommendations for treatment. These guidelines that they create or recommendations are, 15 to 20 pages long, full of fantastic information, but it isn't accessible by a consumer audience. And so what we did was we tried to sort of distill those documents into like a 2 or 3 page consumer-facing document that helps pull out the important information that a consumer would need to know. And then we were able to connect the provider back to those original MASAC documents, along with other resources that we have in the bleeding disorders community. And I highlighted in the ER here, but we have them for bispecific antibody therapy, and we also have some great tools for women and girls with bleeding disorders. So quickly, we've got, again, some great tools and resources for people for women and girls with bleeding disorders. And so wanted to highlight a couple of things here. Our Better You Know campaign is focused on raising awareness of signs and symptoms of bleeding disorders. We also have a website called Better You Know. And again, it's a website that has tools and resources to assess your risk and to get care and treatment. So wanted to highlight those. Victory for Women is another one of our websites, and it's an initiative that provides support, education, and resources for women and girls in our community. And it's an opportunity for them to have space to share stories, challenges, obstacles, and their lived experience. One of our most popular resources for women and girls is this puberty booklet, and there's also a caregiver companion booklet. So this is just one thing that I thought was really interesting. There are so many resources that we had, and it was hard to pick a few, but hopefully I was able to highlight the important ones. Thank you so much for letting me have this space to talk about our amazing resources. And please reach out to me if you have any questions. Thank you so much.
Thank you very much, Brenda. Next up, last but not least, I want to introduce our final speaker today, Rigo Garcia. He's the Executive Director of the Hemophilia Foundation of Southern California, HFSC. It's a mouthful, based in Pasadena, California. Their mission is improving the quality of life and building communities for those that are living with inherited bleeding disorders in Southern California. The HFSC hosts an array of conferences and programs that are geared towards various facets of managing the bleeding disorder. He brings over 18 years of experience in health education, leadership, and outreach, and a commitment to ensuring that marginalized groups are provided primary care access. He serves on a variety of committees, Anti-Racism Committee as an action group facilitator, Diversity, Equity, and Inclusion Committee, and Health Equity Committee, just to name a few. He's received his BS in Health Promotion and Disease Prevention, and he's a member of Public Health from the University of Southern California. Would you take it away, Rigo?
Right. Okay.
I think if you just push an arrow button, yeah, there we go.
Yeah. Perfect. So, welcome. So, as Jennifer said, my name is Rigo Garcia. I'm the executive director of the Hemophilia Foundation of Southern California. And just want to disclose I have no financial disclosures to let anyone know of. But wanted to tell you a little bit more and give you a brief introduction to the bleeding disorders world, the connections that we have with Alejandra and the hemophilia treatment centers, and then what Brendan stated with the National Bleeding Disorders Conference, National Bleeding Disorders Foundation. Sorry. One of the things I really want to state is, when you enter the bleeding disorders world, there are a lot of things that come in mind. What does that mean? There's over 20 different bleeding disorders that one can have. Some of the more popular ones are hemophilia, and we might hear about hemophilia A or hemophilia B. And then there's different severities. There's severe hemophilia, moderate hemophilia, and mild. And what does this mean? How does this work? And these are all the questions that come a lot of the times when you have a new baby. You are new parents and you're told that your baby has a bleeding disorder. And where do you go? How is it treated? Are they going to live a normal life? And so many questions come up with the bleeding disorders world. And what I want to, excuse me, what I want to wrap up with my portion of it is really how do all these different entities, such as the hemophilia treatment centers, the national organizations, and myself, a local organization, really work together to be able to bring services to the community. So there are some national and local support. We have two large national organizations. You heard Brendan from the National Bleeding Disorders Foundation, but we also have another organization called the Hemophilia Federation of America, and they also provide a lot of resources and education. But locally, one of the great things to know about is that there's over 50 plus organizations that are small nonprofits like myself that are throughout the United States, including Alaska, Hawaii, and Puerto Rico, where we provide a lot of the resources, very similar resources. So when I'm telling you, and I'm going to go into the different programs that I do, I want you to understand that organizations across the nation are also doing same things. They might be named differently, but want to make sure that you know that these organizations, this is taking place. Also, amongst all of the 50 plus organizations, we have a great relationship with one another and work hand in hand. So one of the great things about this as well is that if there is a patient or a community member that transfers, let's just say from Tennessee to Los Angeles, we are able to do a warm handoff and be able to assist them. We're kind of like the support system, similar to like the American Heart Association or the American Cancer Society, but what we focus is on the rare bleeding disorders, which again, there are many. And what we try to do is really assist how much as much as we can. So locally, I just want to let you know, when as an organization, we provide education, advocacy, and support for our communities. When we provide education, I'll get into a lot of the different programs and touch base a little bit. It might seem like it's a long list of them, but we just want to give you a simple example of all of the different programs that are available to everyone. I will touch upon advocacy and how we're able to provide education and the tools so that you can be your own advocate. And then the third part is a lot of support. We do have a team that provides a lot of just behind the scenes support. A lot of this could be connecting you to the treatment center that is closest to you, assisting you with insurance, doing case management, and sometimes it's just listening to the family that has been newly diagnosed with a bleeding disorder or doesn't know what to do or where do I go next. And when I said when you're with us, you become family, and that's one of the biggest things about it is that we're one large community, even though we're small across the United States because bleeding disorders is a rare disease. We are able to do a lot, and that's one of the things that I want to be able to show you today on what we do and how we do things beyond just the support and the case management and assisting where needed. We also provide a lot of different services and programs. So our mission is improving the quality of life and building community for those living with an inherited bleeding disorders in Southern California. As I mentioned, we all have different geographical areas throughout the United States. This is myself and my team. We're a small but mighty team. And one of the great things about it is that my team gets involved with every aspect of what we do. So it's not just, the director of development just trying to raise funds, or our director of operations running the office, but they're also assisting with the patients. They're assisting with the community. They're assisting and making sure that, we're working as a strong team, small but yet mighty, to be able to provide a lot of the resources for our community. For California, for those that may or may not know, we're in Southern California, so we cover 9 counties of Southern California. So if you could see, we're right above San Diego, and then we go all the way up north, just touching Central California. And in California, there are 4 organizations all in total that are like mine. There's San Diego, there's Southern California, there's a Central California, and then there's a Northern California. And we work in conjunction together to make sure that we're able to provide a lot of the resources for our community. We're one of the oldest organizations across the nation. We were established in 1952. Several years ago, we celebrated our 70th anniversary. And we're one of the largest and most diverse populations in that we provide, within our geographical area, we provide service to over 4,000 community members. And for the most part, as you could see, about 60% of our community is either Spanish or bilingual, and only about 30 to 40% are monolingual English speakers. So what do we do? Why are we here? What's the importance of having us and being connected with us? Well, one of the big things that we do is making sure that we're able to provide access to care for a lot of the disparity groups. This might be groups that have a lot of language barriers, immigration status, cultural differences. As you know, the United States is a melting pot, but here in Southern California, it even is much more diverse. And one of the great things about our organization is that we're able to provide a lot of the resources and programs, not only in English, but also in Spanish. Some of these, and I'm going to go directly into some of the programming that we do, but one of the ones when we kick off the year is called Industry Forum. And this is where we present information on new products that different pharmaceutical companies have. We bring them all in and they do classroom style education. So if, let's just say, you have hemophilia A and there's 2 or 3 companies that have medications on hemophilia A, this is where you can talk to them. You can talk to the representative, talk about the medication, what's best for my child, and be able to get those questions answered directly from the manufacturers. One of the big programs that we have, and various programs that we have, are very focused to different populations within our community. Not that we want to be able to segregate our programs and do things separately, but a lot of times it is different when we have our women all together, our men all together, or our teens all together, because they're able to talk about different topics and different services that they need. My background, just very quickly, is I'm a counselor and a health educator. I worked in community clinics for 20 years prior to coming to this. So this is where I see that these various programs are very important. Every year we host these. We have a women's retreat, which is an overnight event for our women. We usually have 80 to 90 women that attend this event. We provide education on how to do self-care, how to take care of others, because a lot of these women may have a bleeding disorders diagnosis, but they also may just be a caretaker. And I don't want to say just a caretaker, but there's so much that happens behind the scenes. And some of them have double roles with that, where they have a bleeding disorder and are a caretaker as well. And we want to make sure that these women have the support, the resources that they can move forward. And we'll do yoga classes, we'll do art therapy, which is really wonderful. It's an overnight great event that we have annually. We also provide events for our men, which are called our bro events. And we try to do different events with them, where it's usually men and their sons, and try to do just either sports activities or more physical, because a lot of the times, many times people with a bleeding disorder were told that they could not do different programmings or physical activity. And with the changes in medication, we're able to do so much now. And then we also do teen programming, and that's something new that we've done, and that's just the voice of the teen. And also something that's very different and different with us is that we have a program called Mujeres Unidas, which is a program for women who only speak Spanish. Let me see now. Then throughout the year, we also have different events. We have our Family Information Day, where we invite all of our hemophilia treatment centers and our doctors to be able to do roundtable and answer questions for our community. We also do our family retreat. This is where we take our families up to the woods. We teach them how to be able to do self-infusion, as this is the only way, this is one of the ways, I should say, that patients with hemophilia can receive their medication. We have our back to school event. This is where we talk about our 504 plan, our individual healthcare plans, what the parents need to know about the rights when they have their child. We also provide backpacks and supplies to the community. We have our family retreat, which is similar to our family info day, but this is where we just have a lot of fun. We provide education, but then we're able to allow the family to be together and to be around other families that have bleeding disorders. One of our big flagship programs is our Camp Blood Brothers and Sisters. This is where we take kids that are age 6 to 17 years old to camp for a week, and this is where they're around other kids that have a bleeding disorder and are able just to be kids, which is a lot of fun and very exciting through this. And with our other chapters in California, we host Familia de Sangre. This is the largest all-Spanish bleeding disorders conference in the country. The annual event draws hundreds of Spanish-speaking families. This year, we had a record of over 700 community members that attended, which is amazing. And then also what we do is that we provide family assistance, where this may be emergency financial assistance to assist with food, bills, and whatnot. And then we also provide medical ID bracelets on an annual basis for our community members. And one of the big things with advocacy is that we do create advocacy, and we provide advocacy. We take patients to this state level as well as the national level, and the National Bleeding Disorders Foundation. They host our Washington Days every time in March. And this is where we bring community members throughout the US to talk about the issues that are affecting people with bleeding disorders and how different legislations can affect us. And then, of course, we have a great partnership with our hemophilia treatment centers. We have 3 here in Southern California. And one of the big things about this is that we make sure that we're able to visit the treatment centers on a regular basis. We have monthly meetings with our social workers and myself to make sure that we know what's happening across not just Southern California, but the US. And then we're able to assist patients and be able to connect them to different services and, again, different healthcare. So that's one of our main things with our partnerships with not only our hemophilia treatment centers, but also our National Bleeding Disorders Foundation partner, which is a great support for us. So thank you so much for your time, and I'll pass it back to Jennifer. Thank you.
That was great. So much information. Have quite a few questions of my own, but we'll make sure we get to the ones from the audience first. And I also have a couple that, as you remember, we talked about floating a couple of questions around, and I kind of wanted to make sure we had a chance for everybody to answer this first one, because I think everyone will have a different viewpoint. We're going to try to make the answer a minute or less, knowing that you each come from very different backgrounds and you have a lot of different lived experiences. When you think of whole person care with bleeding disorders, like, what does that look like in your day-to-day work? We'll start with Alejandra. So when you think about the healthcare ecosystem and whole person care, what does that look like in your day-to-day work? Like, what things do you do in your work to make sure that that is how things line out?
I don't think
Alejandra,
your
I think you're
audio is
muted
working.
again, or you're, yeah. It's the story of my life, so I totally get it. Still can't hear you. So, nope. All right, Brendan, you answer real quick while we have Alejandra see if she can figure that out.
Great, happy to do that. I think for my perspective, I actually have 2 adult sons with severe hemophilia, which I didn't disclose, but looking at them and sort of like, what they have gone through. I think one of the most important things that we need to do as consumers is to be well educated on not only our bleeding disorder, but treatment options and resources. And so I think that is something that, helps in a variety of ways, and specifically being educated and understanding the complexity of some of these treatment options enables you to have really great conversations with your provider to figure out the best treatment option for you. So I would say education.
I love that. Thank you. All right, Alejandra, let's see if we can hear you now.
There we go. Sorry, guys. I had to switch over to my phone. My
No worries.
laptop is playing games with me today. Anyway, so when I'm looking at whole person care, I'm looking at everything beyond just medication. I'm looking at how's housing, how is your financials, how are you doing in school, how are you doing at work. I'm looking at all that because that plays a huge component if a patient will be adherent to their medication. I've seen it firsthand and I see it all the time here in clinic. So I'm the one that asks those really uncomfortable those questions are you able to afford your basic needs? Are you able, or do you have a stable household? Do you feel safe in that household? Those are my questions that I bring into my annuals every single time I go in. And if I have a better picture of what's actually going on, then I can create a better plan and connect you to the appropriate resources that the patient may need in order for them to be successful in their medication management. So that's what it looks like for me.
You're making it individualized for what the
Yep.
person actually needs and making sure that they can absorb the information about the other pieces once you get the stable building blocks. That's
Yes.
great. Rigo, what about you?
So with that, whole person care is just really being an extension of the treatment centers. We know that the medical care is the primary care for the patient, and we're an extension of that. So, being kind of we're the beyond the four walls of the treatment center, where we do provide that comprehensive care, where we are looking at the mental aspect of it, the social aspect of it, the community aspect of it, and the education aspect of it. And we know that many times the treatment centers do not have the time available just because the appointments that need to be seen and the patients that need to be seen. So we become that we're that connection to it, but we're really working together with our treatment centers. Earlier today, I reached out to Dr. Kwan because a patient is having back surgery, for example. We want to make sure that he knows what it is, what he needs to do to be able to prepare for that back surgery, but then getting that medical advice and who should we send him to, where should he go to get this treatment. And I feel that that is part of that whole person care, is when we all work together as one for high quality care for the community member.
That's great. One of these questions I felt was going to be really appropriate for Brendan. And it was the one that says, can you help highlight one very underused local or even national resource that could significantly help families or patients and even their providers?
Yeah, I say steps for a living. I talked about it a little bit in the presentation, but I think there are hundreds of pages of information. Things like checklist on how to do an infusion or an injection, getting access to mental health resources, a deep dive on, various bleeding disorders, making sure that you understand your bleeding disorder and the treatment options that are right for you. It could be something like, how do I travel with a bleeding disorders? I want to go to Europe. What do I need to think about, right? So it's that and more. It's insurance. It's all. It's a great, comprehensive, easy to navigate site that really does provide a lot of great content for consumers.
That's great. And you mentioned that that is QR codes. I saw that in your presentation along the way. We'll have that. Will be there on our website for anyone to look at and or use those QR codes, or just to navigate to the website for NBDF as well. Yeah, another question that I thought about that would be really great for Alejandra was to ask if you could I'm sorry, I just asked that one. It was the wrong one. My highlighter was off. It was, what common barriers do you see that are happening on a regular basis? You've mentioned some of them, but are there any barriers in particular, maybe a particular social determinant or
Yes.
some type of thing that is always showing up as a barrier?
Yes. So, it's really funny. I was speaking with our team yesterday, and this is just happened. Yesterday, I was on the phone for 2 hours. I had a patient who he finally decided, I want to go into detox, want to go have some rehabilitation services provided. It took me 2 hours to find him a bed, not because of insurance reasons or because he had to be clean for 24 hours. It was because of the hemophilia aspect. So that is something that across the board for any social work conference, we always hear that's number one. There's an amazing tool called BD Sumac that was created from I think what's it called? Linkins is a big proponent of that, and she's compiled a list of organization of rehabilitation centers across the country who are accepting our patients. It is still growing list, so if anyone has any extra services to be provided, that would be great. But that's how long it took me to find a bed because of the diagnosis that my patient has of having a bleeding disorder. And I understand, I get it. They don't want any needles, but this is part of their care. So how can we provide them detoxification services that with the diagnosis that does require for needles? So it is an ongoing struggle journey to build up this checklist. So I would appreciate if anyone has any resources to continue adding to that so it doesn't take us as social workers 2 hours to find somewhere.
That's the key to doing all your work. I think we're about 2 minutes left, and I wanted to make sure that we wrap things up on time. Gabrielle, do we have time for any more questions? You think we're at 1 minute? I think we're probably wrapped up.
I don't see any coming in,
Okay.
but if anyone has any last minute things that have come up, please throw them in the chat. We can also answer those in the post when we post the video offline. All right, I'm not seeing any. I would like to extend a huge thank you to our speakers today. This was a wonderful session full of information. I hope that our participants have found it helpful. I know that I have. This recording will be posted on Accessia's website. You'll also receive a brief survey after the webinar is over. Please do take the time to complete that if you can. It helps to ensure that we provide helpful information and content moving forward. If you're not already doing so, please follow us on social media at Accessia Health to learn about other presentations and upcoming webinars. And again, I just want to thank everyone who was able to attend today. And again, to our presenters, we look forward to seeing you at future events and also to receiving your feedback. Thanks. Have a good afternoon.
Well,